And let's get back to our top story. We were able to reconnect with Dr. Anant Bhan, global health researcher in Bhopal, India. And we were talking about the aid coming into the country from really all over the world. How is it getting, if at all, to the most vulnerable Indians?
Roee, thank you for having me. Yes, so a lot of aid is now certainly coming into India, but it's primarily medical aid, which is targeted at hospital settings. The challenges for those who are poor, especially in urban settings, is one around loss of income, because a lot of state governments have now gone in for mitigation strategies such as lockdowns. And this was a similar situation last year as well, but there was a lot of civil society organizations which stepped forward. There was a lot of donations which were happening, which were helping people tide over this year, because everyone has been so occupied with just trying to respond to the pandemic. I guess those support systems are a bit weaker. And there is a need for the government to hence step up support systems so that those who are, especially on the poorer end of the socioeconomic gradient, get access to finances, food, ration, etc., to help them tide over during this period.
Has the Prime Minister Narendra Modi lost control of India's COVID crisis?
Well, I don't think the government really was estimating the possibility of such a rapid rise, the so-called second wave, as we are calling it, and it's been, difficult for them to manage. It's been difficult for state governments to manage. Now there is certainly a reason for, the governance system to be set right, because we need the existing crisis to be handled in a very prompt manner, and also for our vaccination program to be fixed, because it's going very, very slow over the last few weeks. And we all know that vaccination has to be one of our primary ways of responding. So hopefully the government, both at the central level and the state level, is paying close attention.
How centralized is the vaccination program? There's also been some significant, not a setback, vaccine hesitancy across the country. How is that being handled?
Yeah, there were concerns around vaccine hesitancy, but quite honestly, I think right now the concern is more around not having enough vaccines. Now that vaccine distribution has been relatively liberalized, the state governments have been also given the rights to go ahead and procure vaccines of their own. Now vaccination is also open to anyone above 18 years of age. But the problem right now is that you can register on the platform, which allows you to access a vaccination slot, but vaccination slots are not available because there aren't just enough doses available for the number of people who want to get vaccinated. So I guess the supply constraint is the major challenge right now.
The U.S. has thrown its support behind an Indian and South African push for the temporary easing of intellectual property restrictions. The European Union is opposed. I spoke with somebody who works on intellectual property for the FDA here in the U.S. and says this is simply grandstanding and could set a dangerous precedence. Your thoughts?
Yeah, Roee, so it's a good thing that discussion around suspension of IP rights. So quite honestly, it's just going to be one of the first steps in a relatively long-drawn process before we see any impact in terms of more access to vaccination. If anything, you will also require to have conversations around tech transfer, around manufacturing capacity and the availability of raw materials. In the absence of that, it's a good, in principle, step, but it's clearly not going to be enough in terms of increasing access in low and middle income countries.
Dr. Anant Bhan from joining us from Bhopal, India. Thank you for your insight.